everyone, wherever you are. I'm sure that it's not morning in every place we are. This is 11 o'clock in South Africa, and we welcome you to this event, which is part of the discussion fora that the Center for Human Rights presents. And the idea here is that we have some of our alumni who are presenting. This is the sixth in the series that focuses on COVID. Up to now, this has been like a closed event for alumni participants only, but we thought, why not make this a public event? So the presenters are alumni, but obviously the event is public, and we welcome all of you here. Just to remind you that as a center, we also present on Tuesdays our COVID talks. That is a more general participation from whatever experts we can involve. So we have Tuesdays at 11 South African time for our COVID talks. And on Thursdays at 11, we have these discussion fora at which we also look at the moment at COVID and its impact for and implications for human rights and democratic governance. So welcome once again. I think people are just entering the meeting. We welcome you and thank you for your time. We know that there are many contending priorities at this time. My name is Frans Viljoen. I'm the director of the Center for Human Rights, and I'll be the moderator. Let me then at the outset just do a few housekeeping arrangements. I think most of you are familiar with these now. Please keep your microphone muted and your video closed. We will try to have an opportunity later where we could see by a show of hands if anyone would like to take the floor. For the moment, we ask that you please contribute to the chat room, make your comments and pose your questions on the chat room. Please, again, let's ask everyone to mute your microphone and also close your video, please. Even one person not doing so, please. Boniface, yes, thank you. So, the sequence of events today will be that we have 4 speakers who will speak for 10 minutes each. We will then take your questions and comments, hopefully have some people from the audience participate, and then round up. I remind you that we also have the event live streamed on Facebook, and that the event is being recorded, so you'll be able to refer to the recording afterwards. So once again, welcome if you just joined us at this event, part of the discussion fora that the Center for Human Rights hosts, where its alumni are the presenters. This morning in South Africa, we look at the African governance architecture and its response to COVID-19. I think it's very opportune that we do so in this week. As you know, we celebrated Africa Day on the 25th, remembering that the OAU was formed on that day in 1963. But in my view, there's actually a second Africa Day in this week, and that is the 26th of May. Because as you may know, the African Union Constitutive Act entered into force, and that is really the current formation of our regional integration that has come alive, if you like, on the 26th of May, 2001. So for many reasons, those being 2, I think it's opportune and very appropriate to be looking at the issues around the AU, human rights and democratic governance. Now, to address this, we could look at all the aspects of the African governance architecture, but today we have 4 represented here, and I think they are 4 that really have a salient role to play. The African Commission, the African Committee on the Rights and Welfare of the Child, the African Peer Review Mechanism, and the Pan-African Parliament. So first of all then, we will turn to the African Commission on Human and People's Rights. And we are very, very fortunate to have the chairperson of that commission, Commissioner Solomon Dersso, here to present. I asked all the presenters to basically look at the modalities, the way of operation briefly, how that has been impacted by COVID-19, but more fundamentally, what influence has COVID-19 had on the way that the different organs or entities see their substantive mandate, what focus shift perhaps is taking place, and what has been done and what is being planned in terms of responding to COVID-19. So very briefly about Chairperson Commissioner Solomon Dersso. He has been elected to the Commission in 2015, and before that, he had served in various capacities around issues pertaining to human rights and security. He is, we claim, as the center and alumnus of our program in Human Rights and Democratization in Africa, the Master's Program from the year 2003. He's an adjunct professor now at Addis Ababa University, and he also looks after the specific interests of extractive industries and the environment within the African Commission. So, Commissioner Chairperson Solomon Dersso, thank you so much for agreeing. The floor is yours.
Apologies. Yeah, sorry about that. Thank you very much, Frans, once again for the kind invitation extended to me to join you this morning, this afternoon, or this evening, wherever you are. Good morning, good afternoon, and good evening. For us at the African Commission on Human and People's Rights, understandably, COVID-19 have had very serious repercussions in the way that the Commission ordinarily operates. Of course, the African Commission on Human and People's Rights is not unique in this respect. The Commission is mandated to protect, promote human and people's rights on the African continent, and the Commission does this through various mechanisms. One of the most important mechanisms of the Commission, as you all know, is the convening of the ordinary sessions of the African Commission on Human and People's Rights. And one of the, the highlights of the work of the Commission actually is this ordinary session where member states of the African Union, parties to the African Charter, national human rights institutions, civil society organizations, partners and other organs of the African Union come together to a public discourse debate on the state of human rights on the African continent. That is also an occasion when we ordinarily review reports of states parties to the African Charter on Human and People's Rights within the framework of both the African Charter and Article 62 of the African Charter, but also under the Maputo Protocol in its Article 26. So one of the major casualties, so to speak, of the coronavirus, the novel coronavirus pandemic, as far as the African Commission is concerned, is the inability of the Commission to convene its 66th ordinary session that was meant to take place from the 21st of April. So this is indeed quite a huge setback in terms of the work of the Commission, on account of the fact that there were around four, for example, reports of states parties that were meant to be reviewed during this time, and also quite a large number of activities that were meant to be carried out during this session. So, one of the major consequences of COVID-19 is, of course, the fact that the Commission has to abandon the convening of this session. In the light of the various measures that have been introduced by countries, which led to the freezing of activities of international institutions, including African Union institutions, and the various measures required both to keep the safety of staff of the Commission, but also to continue with the work of the Commission. We, at the level of the Commission, particularly at the level of the Bureau, we initiated an internal guidance for the Commission as far as the work of the Commission is concerned. Given the cancellation of the 66 organization, given also the consequence of this on the workload of the Commission, we needed to basically change the way we organize our work in the Commission. So we initiated an internal guideline to that effect. So on the basis of this internal guideline, we requested and provided guidance to staff and members of the Commission in terms of how we deliver on our mandate. And in this respect, I think I have to say that the most interesting aspect of our reorganization is the recognition from the get-go on the part of the African Commission that this situation requires, more than any other situation, the engagement and active follow-up by the human rights bodies of the African Union, by the African Commission on Human and People's Rights. We therefore treated COVID-19 itself as a human rights issue. That's why we were the first, for example, to issue a statement on COVID-19 on the 28th of February, when the COVID-19 cases were still very low and limited to a handful of countries at the time. We therefore deemed it necessary that COVID itself is a human rights issue, but also once COVID started to spread across the continent, we also recognize that there are human rights issues arising from COVID-19 response measures, which also require, more than any other time, the engagement of the African Commission on Human and People's Rights. So we tried to mobilize the entirety of the mechanisms of the Commission in terms of special mechanisms, in terms of country rapporteurs, and also importantly in terms of really reaching out to a wider scope of audiences or basically stakeholders, states, national human rights institutions, civil society organizations, and importantly also engaging with the media. So if you go and check on our website, you will find one major statement that we issued on the 24th of March, providing in an exceptional way, very detailed guidance on what needs to happen during the COVID-19 and why it is important for member states and indeed for members of society to respond to COVID-19 within a human rights framework, and why that is a success, a measure of success in terms of the response to COVID-19, since COVID-19 response can only succeed if members of society are mobilized and if members of society are the front and center of the response. And you can achieve that only if you are doing it on the basis of and following the standards of human and people's rights. There were also specific thematic statements that have been issued, communications that have been also addressed to the African Union system, to the chairperson of the Union as well. So basically, and of course, leveraging the partnership of the Commission, thereby engaging other actors, including, for example, the UN High Commissioner for Human Rights, with whom I collaborated for issuing a joint statement, having regard to the fact that the impact of COVID-19 and perhaps importantly, the socioeconomic fallouts of COVID-19 would have a very devastating human rights consequences, particularly for the most vulnerable in our societies. And this also has a very important international dimension, and therefore the need for this kind of collaborative engagement with the global human rights system, and making a case really on a couple of points. First, COVID-19 requires us to revisit and critically rethink what we call the economic development model that is advanced as the way for development by the international system. It has shown that where there is no access to water, no access to sanitation, no access to healthcare, no access to education, the society would be left extremely vulnerable, including to the kind of pandemic that we have witnessed. And where you have such vulnerability, it becomes difficult to protect even those who think that they could have provided for themselves. It requires us to rethink the fundamental importance also of socioeconomic rights as fundamental rights, and hence bringing them to the center of not only the discourse, but also importantly, I think that the challenge for the human rights community, importantly, how these socioeconomic rights basically shape and inform policy making, both nationally, but also at the regional level. I think these are extremely, extremely important issues. We have to review how we have come to this point, why so many of our people are vulnerable, and why that is the result of wrong policy choices and wrong priorities. And we have also to respond to the emerging human rights issues, which are pressing, immediate, but we have to think about, okay, what next moving forward? I think these are really the parameters within which we, as the African Commission on Human and People's Rights, have been operating. And in this context, of course, we are planning also to prepare, just like we are doing here, a session virtually. And we hope that we will succeed in bringing together our various stakeholders to that session, focusing on COVID in particular. Fingers crossed that everything will work out to that end. And this basically underscores the fact that it is in times of crisis and emergencies that we need human rights more. There is a perception that human rights can wait, that we have to respond to COVID-19, but that is a very terrible and wrong perception. We need human rights more during this time, not only because human rights guarantee you in making people the front and center of the response, which is a critical factor for success, but also because during this time, both the accountability mechanisms become weaker and the power of the state, particularly that of the executive body, gets extremely accentuated and exaggerated, with all the risks associated with the abuse of such excessive accumulation of power, and hence the need for more human rights, not less, during this time. Let me stop here, and maybe we'll come back by way of question and answer. Thank you very much again, Frans.
Thank you so much, Commissioner Dersso, Solomon. I see a few people joined us since we started. Just to welcome you all again. Here you are at the Center for Human Rights discussion forum number 6, looking at the responses to COVID-19 of the African human rights governance architecture, or the governance architecture in general. We've had one speaker, the chairperson of the African Commission on Human and People's Rights speaking. We will have 3 more speakers, each using more or less 10 minutes. Thereafter, you are welcome to, we'll seek an opportunity for you to contribute, but otherwise, put your questions in the chat box for now. Let me remind everyone just to keep your microphone muted and your video closed. We will then move on to our second speaker, who is Professor Benyam Mesmour. He is currently a member of the African Committee of Experts on the Rights and Welfare of the Child, so he's very well placed to speak exactly to the response to COVID-19 of that body. But let me just, by way of brief introduction, say that Professor Mesmour was also for 2 terms the chairperson of that committee. So he's been on the committee and chaired it. He has the unique quality also of not only being in the African human rights monitoring bodies pertaining to children, but also in the United Nations. So he's also a member of the United Nations Committee on the Rights of the Child, and also, in fact, served as the chair of that committee. At the University of the Western Cape, where he's a professor, he also holds the position of Deputy Dean in the Faculty of Law on matters of postgraduate and research issues. So he certainly is a busy and a multifaceted person, but today we appreciate your time and contributions on the issue of how COVID has affected and how it will be affecting the work of the Committee of Experts on the Rights of the Child. Thank you so much, Benyam.
Thank you very much, Frans, for having me. It's a pleasure to be able to join here. Quite a lot of the points, particularly the procedural and institutional points that were raised by Commissioner Solomon, predominantly echo with what is happening within the African Committee of Experts on the Rights and Welfare of the Child. We were supposed to have our session in March, then we postponed it to April, and then if April was not going to work, we had postponed it to June, but as things stand now, it's not even very clear what the situation will be. Obviously, the conversations about what should be the role of treaty bodies, not just only the African Commission and the African Committee of Experts, but also a whole range of other treaty bodies, including within the United Nations system, in terms of filling the vacuum that might be created as far as human rights protection is concerned, generally, is a conversation that is ongoing. So the options about trying to do some of these things online and trying to adapt to the current attendant circumstance that we're facing is a conversation that we're also having. One interesting aspect as far as the work of the African Committee is concerned, we were scheduled to have elections during the next African Union Summit. So 6 members, including myself, I'm finishing my second term, my final term, are actually outgoing members. So that's the majority of the committee. Now that the African Union Summit has been postponed, it's not even very clear whether or not the committee will actually have a quorum to function beyond July. So from an operational point of view, that also has its own implications. But I'm not going to spend a lot of time in terms of the institutional issues. Let me just at the outset mention 2 or 3 things. The first is that we issued a guidance note as the African Committee of Experts on the Rights and Welfare of the Child. We issued a guidance note to states, which is about 7 pages. The one that the UN Committee on the Rights of the Child issued is just only 3 pages. But we issued a detailed guidance note to states in terms of some of the issues and what the child rights focus should be, and some of the considerations that they need to do as they undertake measures to address the challenge faced by COVID. Now that's the first one. The second one is 2 weeks ago, the Peace and Security Council held its session on children. Now, during that session, we had the opportunity as the African Committee to brief the Peace and Security Council actually issued its communique on the subject matter, going actually beyond the children in armed conflict conversation that the Peace and Security has been engaged with for a long period of time. At this point in time, the Peace and Security Council actually looked at children's well-being and its broader context in terms of security. So the communique has been issued. We're very happy that we've been able to provide input into that process, and it helps us to cover quite a number of ground as far as African Union member states is concerned. And fortunately for us as well, the Peace and Security Council has also said that it will continue to be seized of the matter in moving forward. So it was the first, probably, obviously not going to be the last conversation that we will have on children's rights and COVID with the Peace and Security Council. Now, having said that, the third point at the outset that I want to mention is that the conversation about COVID beyond the continent or even beyond the continent has tried to look at children as being on the margins of this pandemic. Most of us, we beg to differ. I often try to remind people that there is no crisis. There is no crisis that is a child rights neutral crisis. We can talk about the South Sudan crisis, the Ebola crisis, the financial crisis, the Yemen crisis, the food shortage crisis. It always has a children's face at its front. So even though the pediatric cases involving children are reportedly minimal, we are already seeing quite a number of connections, how it actually accelerates vulnerabilities, how violence against children is increasing, and a whole range of other related issues that pertain to children coming to the fore. I wouldn't be surprised in the foreseeable future that this actually moves from being just a general human or human rights crisis to being a children's rights crisis. There are already some of the indications that are pointing in that direction. Now, the first substantive point, let me move to a few substantive points that I believe require quite a bit of a conversation. The first is in relation to lockdowns and state of emergencies, how are they supposed to be done in compliance with children's rights? This is an issue that we, as the African Committee of Experts, even as the UN Committee on the Rights of the Child, have not directly engaged. We know about the engagement from the Human Rights Committee. We know about the role of Article 4 of the International Covenant on Civil and Political Rights and so forth. But what it actually means from a child rights point of view and what it actually means from the regional instruments, in this particular case, the African Charter on the Rights and Welfare of the Child, is not an issue that we've been able to invest some intellectual input into. So we are already seeing that the state of emergencies are having significant effect. For instance, children in street situations. There have been a number of reports of violence against children by police officers in a number of African countries under the guise of implementing lockdowns. Some of the decisions that are being made as being compulsory, I mean, even things like curfews and so forth have significant effect on children. And one of the things that we're also seeing is that, for instance, measures aimed at stopping COVID spread can pose challenge to timely and effective delivery of life-saving assistance to children in need. For instance, there is one country in West Africa that we've had the opportunity to look at where the government suspended flights by aid groups as part of its COVID-19 response, and this ultimately jeopardized their operations. So we have also seen a number of instances where measles vaccinations or routine vaccinations have been suspended. So how to actually address states of emergencies and lockdowns in a way that actually complies with child rights standards, in this particular case, the African Charter, is an issue that actually requires a more nuanced approach. Now, the next point that I just want to mention is there needs to be a very important look at the statistics. UNICEF issued actually a statistical overview of what is going on in relation to COVID globally, but also with a bit of a focus on children. Usually the numbers tell a very fascinating story. Now, some of the basic things, for instance, we know for a fact that children, particularly those in the most impoverished, are going into a direction where the effect of the pandemic is going to be catastrophic. I'll just mention one or two examples here. There have been a number of issues and messages that have gone out saying hand washing with soap and clean water is absolutely important in addressing COVID. But I think when you look at the statistics, nearly 3/4 of the population in sub-Saharan Africa lacks basic hand washing facilities at home, which is, as I said, a fundamental mechanism to prevent COVID-19, leaving already vulnerable people at a very disadvantaged state. As many as 3 billion people lack hand washing facilities with soap and water available. And a significant portion of these are actually here on the African continent. So quite a lot of the statistics, I just mentioned one here, needs to be contextualized in terms of what its implication will actually mean for the lived reality of children on the ground, and the kind of measures that states actually put in place needs to be able to reflect these realities on the ground. Now, the third point is, in the context of lockdowns, again, there is a need to define a few child protection services as essential services. This could include demobilization, disarmament, and reintegration services that actually involve children involved in armed conflict. It might include mental health, including psychosocial assistance. One of the information that is supported by data that is coming out is that in the next phase of the COVID pandemic, children's mental health will come center and front. And from that point of view, unless and otherwise, these child protection services or social services are being labeled as essential services, the extent to which children will fall between the cracks is significant. And in this respect, I think as Africa, we don't need to look any further than the effect and some of the lessons that we've learned from the Ebola crisis, how birth registration processes were curtailed and a significant number of children were left out of the birth registration process, how child helplines were closed, and the opportunity for children to actually complain about some of the violations that they're being exposed to was falling between the cracks. And while I'm on the issue of child helplines, it should not just only be a focus on how children should be able to go online and report violations. It should also be reflective of the reality on the ground on the African continent, where text messages, phone calls, and so forth are some of the major ways by which children actually report violations of children's rights, not just only on them, but also on their friends and on their classmates and so forth. So it's important to keep this in mind. And again, I come back to the immunization services that have been postponed. Globally, more than 30 or 40 countries have postponed that, and that will obviously create a backlog. And again, if one was to look at closely what happened in the context of the Ebola crisis, after the Ebola crisis, there was a significant importance and drive and resources, both human and financial, that was needed to address the gap that was created because these services were put on hold while the response was predominantly focused on Ebola. A fourth point that I think is not necessarily getting the attention that it deserves is the conversation about access to information, and especially for those children that are in vulnerable situations, children from minority groups, children in orphanages and alternative care settings, or children in refugee camps and so forth. This is absolutely important. It's also a way of addressing false information. We often talk about social distancing. One of the things that we also need to talk about is false information distancing. Unless and otherwise children actually have the relevant and important and scientifically verified information, it becomes very difficult to address the challenge that we're facing in terms of COVID. I mean, there have been quite a number of issues about discrimination and so forth. I'm not going to go into them, but at least just a simple issue that I want to throw here. Even the notion that says the Spanish flu or the French flu and so forth, that is misinformation. That is something that actually fueled discrimination. So the access to information should also be intended to address children's concerns in a child-friendly and accessible manner, but also to address issues of bullying and discrimination and so forth. I'll just throw 2 points here, and then I will wrap up in the interest of time. In terms of children that are in refugee and IDP camps, social distancing is a luxury, and the extent to which states are actually prioritizing the needs of those children who are finding themselves in the margins of society, we're not seeing it. For instance, travel restrictions should not be used to deny the right to asylum. If health risks are identified, screening arrangements must be put in place, together with testing, quarantine, and other measures that children in IDP and migration situations should benefit from. A final point that is increasingly coming up is the link between the current COVID situation and detention and risks. Detention, particularly its risk with COVID infection, has been clearly highlighted. For instance, Human Rights Watch has done a global survey of media reports, which found that governments from at least 70 countries have announced release orders covering over 50,000 detainees. In conflict countries, thousands of children are currently being detained for alleged involvement with armored groups or groups that have been declared to be terrorist groups and so forth. And that's an issue that requires a very close attention to make sure that deprivation of liberty is a measure of last resort. My final point, I think, in moving forward as a treaty body, monitoring the implementation of the African Charter on the Rights and Welfare of the Child is not going to be business as usual. There are quite a lot of things that we need to reflect on in moving forward. And I look forward to reflecting on some of these points probably in the question and answer. Thank you very much, Frans.
Thank you very much, Benyam, for those, I think, succinct but very pointed remarks. I think just reminding everyone to keep the microphones muted, but that works well. And we are busy discussing the African governance architecture and its response to COVID-19. We looked at the African Commission on Human and People's Rights. We looked at the African Committee of Experts on the Rights and Welfare of the Child. We now turn in the third presentation to the African Peer Review Mechanism. And Ms. Mary Izobo will take us through that discussion. Thank you very much for agreeing. She served as legal officer at the APRM, and she has personal insights into how the APRM functions. She's also been following closely how they have responded to COVID-19. She, interestingly enough, has moved to the Pan-African Parliament, where she actually works at the moment, but it is a deep understanding of the APRM that makes her a very appropriate person to talk to us about COVID-19 and its impact, potential, and realized on the APRM. Thank you very much, Ms. Izobo.
Thank you so much, Professor Frans, for the introduction, and good morning, everyone from South Africa. Like Professor Frans already said, I will be talking about the APRM's response to COVID-19. But before I delve into the crux of the matter, I would like to just give a brief background of the APRM for some of the people who do not really know about the APRM. And then I would also talk about the implications that COVID-19 has on governance, and then talk about the APRM's response to COVID-19, and then I would conclude. APRM was established in 2003. It was inspired by the desire to actually create African solutions to African problems in the quest for the promotion and amelioration of good governance on the African continent, and also the need to create a new method to politics in Africa. So simply put, the APRM is a voluntary non-adversarial peer review process mechanism where the review process assesses the country's problems, identify needed actions, and then secure commitments from the country on the review to actually fix the problems. And where they are actually setting a mark for governance in Africa, they are definitely commended for it. The mandate of the APRM is to promote the quality of good governance in APRM member states, because not all 55 member states of the African Union are part of the APRM. And so these countries that are part of the APRM, the mandate of the APRM basically is to promote the quality of good governance on 4 thematic areas, on issues of corporate governance, issues of democracy and political governance, socio-economic development, and economic governance and management. In 2017, based on President Kagame of Rwanda's recommendations to the AU on the AU reform, the AU Assembly decided to adopt 2 additional mandates so that they can expand the mandates of the APRM. The first mandate was, the first extended mandate was now to actually track, monitor, and evaluate key governance areas in all AU 55 member states, as well as the tracking, monitoring, implementation of Agenda 2063 and SDG UN 2030. So what this implies for the APRM is that it no longer monitors, evaluates, and track key governance areas in only the 40 countries that are acceded to the APRM, but in all 55 member states of the APRM. COVID-19 has a very serious implication on governance. I mean, it's affected persons, governments, international organizations, public-private organizations, and it leaves a question for all of us to ponder on the essence, structure, and the capability of their own institutions. Let's take, for example, the measures that have been put in place by countries to curb the spread of the coronavirus. They have been the banning on school. They have been banning of social gatherings, sporting activities, also religious gatherings. They've also been a closure of airports, seaports, land borders, just in a bid to, and also the complete and the partial lockdown of countries, all in a bid to actually curb the spread of the coronavirus. However, these measures that have been put in place have a serious implication on governance, in the sense that, let's take the right to freedom of movement, of assembly, of pickets, of association, and even the right to public participation, or right to political participation, which is the right to vote. On Tuesday, I remember attending the webinar on how COVID-19 affects elections, and we see that a lot of countries have had to postpone indefinitely, maybe, their elections as a result of the spread of the coronavirus. Some countries have gone ahead and gone through with the electoral processes in spite of the coronavirus, but then they've had a serious effect where even people are scared to come out to vote because of one singular reason: they do not want to get infected with the coronavirus. So all of these limitations that governments have put in place to curb the spread of the coronavirus has put a constraint on the quality of governance in countries when compared to life under normal circumstances. The measures taken by government to actually protect the public health, when you look at it, has to be in accordance with international laws on human rights, democracy, and the rule of law. And this is why a response by the APRM on the COVID-19 is very important. At the core of the APRM, you have sustainable development, you have peace and security, and then you have democratic governance. And so it is imperative that the responses from APRM, as the foremost institution for governance in Africa, can actually help curb the spread of the coronavirus, mitigate its effects, and prepare a framework in which, in the event of a crisis like this in future, not just for now, they can actually assist the AU, generally member states, to support governance reforms in Africa that can actually accommodate times like this. The APRM is currently working on a report in collaboration with the African Union Commission and the African Center for Disease Control, which is the Africa CDC. And the objective of this report is to actually propose adequate recommendations to AU member states on a thorough response to the COVID-19 pandemic with crucial implications on governance. The APRM also has constituted a task force to track and monitor governance response to the COVID-19 in AU member states. And this is in line with the expanded mandates of the APRM that I discussed a few minutes ago. The APRM also holds virtual meetings. I mean, that's the only thing that is there of right now because of the lockdown situation. They continue to hold virtual meetings with APRM member states, with all 40 APRM member states, as well as the regional economic communities, so as to provide an outlet for experience sharing, which is very important on how, on national governance and responses to the COVID-19 because of countries' specificities. So it is very important that countries are able to come together under the umbrella of the APRM to discuss their responses to the COVID-19 and how well they can do better. The APRM also supports the reporting of the pandemic by countries through its peer review process. But unfortunately, because of the COVID-19 currently, they are not able to do that physically. And so they encourage countries to go through with the country's self-assessment review process. Through this process, they can actually send the reports online to the APRM, and then the APRM can actually look at it and create background reports based on that, so that in eventuality that everywhere the coronavirus dies down a bit and everybody can go out, then they can actually go into those countries. So instead of actually stopping the work must go on. And so they encourage countries to actually write down their country's self-assessment processes and send to them, and then they can work through the background research and see how they can assist the countries. Also, through the annual country progress reports that countries submit to the APRM annually, they can also use this as an avenue to discuss ways on which the pandemic has affected them as a country, and see ways to which the APRM can actually respond and provide a thorough response to the COVID-19 pandemic in individual countries. The APRM also uses information on governance issues relating to the COVID-19 to assist the Africa Governance Architecture Platform. Last year, in 2019, I remember that the APRM produced an African governance report. And this report was not only on the APRM member states, it was also on all AU 55 member states to provide data on governance issues. And this is very important because it's going to help the Africa governance architecture, from the African Commission on Human and People's Rights to the African Committee on Experts on Rights and Welfare of the Child, even the Pan-African Parliament, ECOSOC, name it. With this, with the data that APRM continues to produce, it can actually help all these institutions as a platform come together and see how they can work on finally curbing the coronavirus. The APRM has also revised its study on United Nations Committee of Experts on Public Administration Principles of Effective Governance for Sustainable Development of UNSG's Goal 16, which is very important for governance in Africa, as well as AU Agenda 2063, Aspiration 1 and 2. So what the study will now do, they're revising the study so that it can now include an assessment of the approaches used by national policy makers in dealing with COVID-19 pandemic. To conclude, the APRM will need to revise its tools and methodologies. That is very, very important. One of the important tools I know of the APRM is APRM questionnaire. They would need to revise the APRM questionnaire to reflect health crises such as the coronavirus. This will assist the APRM to recommend to its APRM member states and even to other AU member states on how to deal with such health crisis or any other disaster that may happen in future. The APRM must also include in its general structure disaster management plans and progress progress preparedness and to enable API member states prepare and prevent such pandemics in future. And this is because the APIM needs to now be proactive as opposed to reactive. So we do not have to wait until we have a pandemic and then we are all rushing to find solutions and trying to recommend or propose assessments on how to deal with it. But as long as we start, and as the APIM, they start to deal with and start to prepare themselves, have structure, they include in their structure disaster management plans, it will enable to plan and prepare in case any of such disaster or pandemics is to happen in future. Lastly, the APIM will need to carry out a research on the strength of a state, on every state's resilience, because again, every country is different in terms of their peculiarities and their specificities. And so it's important that the APIM harnesses on the strength of every single country that is part of its mechanism, so as to help assist with interventions and prefer preparedness and management solutions to these states on an individual basis. I would like to stop here. Thank you so much for your attention.
Thank you very much, Mary. So to those who just joined us, welcome. You are with us at the Center for Human Rights. We are looking in our discussion forum today at the responses to COVID-19 of the African governance architecture with a focus on 4 institutions. We just listened to Ms. Izobo, and she, like the others who are presenting today, they're all alumni of the Center's Master's Program in Human Rights and Democratization in Africa. She completed the program in 2015. We now turn to the last of our speakers, who is also an alumnus of this program, a little bit earlier in 2000 and what was that, 6, that is Clement Mavungu. He is currently legal counsel with the Pan-African Parliament, so he will address the issue of how the Pan-African Parliament is responding to COVID-19. Let me say briefly that he has held this position since 2015, and before that, Clement worked, for example, with National Federation for Human Rights, the Center for the Study of Violence and Reconciliation, and with the ICJ. So thank you very much, Clement, taking time out of your busy work with the Pan-African Parliament to speak to this audience about COVID-19 and its impact on the institution at which you are based. Thank you.
Thank you very much, Professor Frans, for the introduction, and particularly for inviting us to be part of this discussion, which is very interesting. Mine is going to be a contribution on sharing about the challenges of the Pan-African Parliament in relation to the COVID-19 pandemic, the responses given by the Pan-African Parliament in spite of the operational challenges, and I will also touch on the role that the Pan-African Parliament has played vis-a-vis national parliaments of the member states of the African Union. Before ending, I will discuss some operational adjustments that the Pan-African Parliament is working on to ensure that the challenges faced as a result of the COVID-19 are addressed. First of all, perhaps it's important to note that the mandate of the Pan-African Parliament as an advisory and consultative body of the African Union involves examining, discussing, and expressing an opinion on any matter, either on its own initiative or at the request of the assembly or the policy organs, and make any recommendations it may deem fit. I will just limit there, noting that the Pan-African Parliament also has budget power to discuss its own budget and the budget of the African Union, but its power to examine, discuss any matter, include discussing the COVID-19 pandemic, and formulate recommendations as may be appropriate. But one can see that to be able to discuss and to discuss any matter, including the COVID-19, you need a setting, a meeting, and in parliamentary language, we talk about ordinary sessions, where the plenary of the Pan-African Parliament, composed of 5 members coming from each African Union member state, come to discuss these matters. You also need committee meetings, we call them committee sittings, where issues are debated thematically by the permanent committees of the Pan-African Parliament before they can be brought to plenary for final decision. The COVID-19 pandemic has, however, made this impossible, because the rules, the Pan-African Parliament being a rules-based organization, its meetings are regulated by its rules of procedure, which were designed to preclude, from the assumption that ordinary sessions and committee sittings would be physical meetings. When the first cases of COVID-19 were reported, there was a directive from the African Union to suspend all activities involving travel. And therefore, the May session of the Pan-African Parliament was somehow postponed sine die. And it was therefore important for the leadership of the Pan-African Parliament to reflect on ways and means to be able to respond, even in the absence of a plenary taking place or meetings of committees taking place. The Bureau of the Pan-African Parliament came up with a number of interventions, including messages of solidarity to all parliaments of the African Union member states, to sensitize them to give effective responses using, responses to the COVID-19 pandemic using their triple mandate of lawmaking, budgetary, and oversight power. And secondly, the leadership of the Pan-African Parliament also expressed several times political support to the measures being taken by the heads of states of the different member states, calling particularly for more coordination and harmonization amongst the member states. Thirdly, there have been advocacy initiatives directed at a set of member states, for instance, Gabon, calling for the ratification, domestication, and implementation of the African Medicines Agency Treaty, which is an African Union legal instrument advancing access to safe, effective, good quality, and affordable medicines and health technologies. Beyond that, the leadership of PAP, the Bureau of PAP also organized convened meetings with regional caucuses to start reflecting on how the challenges posed by the COVID-19, particularly in relation to the operations of the Pan-African Parliament, can be indeed addressed. And particularly a reflection started on the possibility of having virtual meetings. Confronting this idea with our rules of procedure, which, as I said before, do not make provision for virtual meetings to take place. Working with the Secretariat, now reflections, and I think documents are even ready to that effect, to ensure that the rules of procedure can be adapted to support virtual meetings. And particularly in the rules of procedure, I mean, the rules which have been drafted and are yet to be considered are particularly addressing a number of issues, particularly in case of a virtual meeting. I mean, what are the conditions for a virtual meeting to take place? Because we believe that virtual meetings will continue to be resorted to even after the lifting of the lockdown or even the end of the COVID-19. So what are the conditions under which virtual meetings can take place? They also cover the issue of venue. Should a virtual meeting take place, what should be considered to be the venue of the meeting? The rules also are touching on the issue of security of a virtual meeting. And I think many of us followed what happened with a virtual meeting organized by the Parliament of South Africa. And I think the security of virtual meetings should be well thought out, and there's provision for it. The privilege and order in a virtual meeting. What are the privileges of the members of Parliament? And I think the provision is that they will enjoy the same privileges that they enjoy during physical meetings, and the order shall be the one provided for under the rules of procedure. Looking at also the technical designs of virtual meetings, the rules also make provision for the status of participants in a virtual meeting, which technical status should be given to the members of Parliament, to members of the public, and to resource persons who are invited to address Parliament. The quorum. The COVID-19 has led to a situation where many parliaments, at least those who were able to quickly meet, they changed the quorum rules, which allows a very small number of members to constitute quorum in order for a meeting to take place or for a decision to take place. Some parliaments are also working on the basis of the representativity of the different political forces represented in a parliament, meaning that members of the opposition can mandate one person to represent them in a parliamentary meeting and vote in their on their behalf, for instance. The issue of voting in a virtual meeting, and as you know, parliaments, almost all decisions to be made are more likely to be voted on. And the rules of voting answer questions such as I mean, how voting should take place, who would be entitled to vote, because it may happen, for instance, that one person had logged on to the platform and perhaps left. Should he be considered for the purpose of voting and for the purpose of counting and validating the votes? The security of votes also is one of the things. Public participation in a virtual meeting is also addressed in these rules, and the extent to which technical support should be given to the members of parliament without affecting their right to individually express their opinion in a parliamenary proceeding. I will end there and perhaps elaborate more should any question be raised. Thank you.
Thank you, Clement, who is the legal counsel at the Pan-African Parliament. I think those gave us very, very intimate insight into the complexities of transitioning into a virtual world from the point of view of the Pan-African Parliament. I'm reminding everyone just to keep the microphones mute, but please be forthcoming with comments or questions in the chat box. I think I'll advise everyone to actually look at those comments. They are very, very interesting and valuable comments there. I also note we have participation from as far afield as Europe, France, all across the African continent. I mentioned also, I see some members of parliament, a broad array of civil society actors. So welcome and thank you, everyone. Let me take a few questions. I think the first to chairperson of the African Commission, Solomon. A number of questions spoke to particular vulnerabilities. Women, the women's rights to be safe under COVID-19 lockdowns, older persons, migrants, and indigenous communities. So I think we'll all agree that these communities and groups are always at elevated risk of human rights violations, but it's quite evident that this has been exacerbated in the context of COVID-19. So I suppose the question overarching is, what kind of guidance is it that the Commission is giving to states to prioritize and to adjust in the context of COVID-19 to these particular vulnerabilities within their societies? Solomon.
Thank you very much, Frans. In terms of the guidance that the Commission is giving, I think any crisis, any major crisis like this one, had the tendency of affecting most particularly the most vulnerable, and those categories of people obviously prominently adversely get affected. And we have seen from the very beginning reports that much of the response to COVID-19 from member states focus on protecting, of course, what you may consider to be the mainstream society. And whether it is by way of lockdown, curfews, stay-at-home measures, or all those kinds of measures. I think we have seen from the introduction of those measures that the mainstream society becoming the standard can have very adverse consequences, particularly for those outside of the mainstream society, so to speak. So these are, for example, migrants, asylum seekers, refugees, and so on and so forth. And you also have, because people are forced to stay at home in many countries, we have witnessed a major spike in gender-based violence, in domestic violence. We also have witnessed over the course of this period, as a result of the disruption of economic activities, particularly for those operating in the informal sector and those in precarious employment conditions. Their livelihoods have been wiped out, and as a result of that, people have faced very severe economic conditions, including facing starvation and hunger. Obviously, I think from the African Commission perspective, these are all the factors that we have taken into account in issuing the first, the second statement, that was the statement that we issued, as I indicated earlier on the 28th of March, after many countries have adopted the COVID-19 response measures. And in that statement, we have outlined some 12 points that need to be taken into account in how member states respond to that. And what we did was not just to issue a statement, publish it on our website and circulate it, obviously, to our stakeholders, but we also specifically wrote note verbals and letters to member states attaching the statement and reminding them the obligations that they bear under the African Charter on Human and People's Rights, even as they respond to the threats of COVID-19 to life and obviously to health. So we singled out, obviously, these vulnerable sections of society, and we have said that whatever measures that they take has to factor in these categories of people. And indeed, its compliance with human rights would be assessed on that basis. So I encourage all of you to really go and have a look at that. And the other thing that we did was also, of course, it was a remarkable response that we have got in that respect. A number of organizations have started to make use of the statement issued by the Commission as a framework for their human rights advocacy, other framework for also following compliance of states in that respect. Then we have gone to country specific responses by country rapporteurs. So we have seen, letters of urgent appeal. We have seen specific statements in respect to specific thematic issues that have been issued by thematic rapporteurs of the Commission. We have also seen, for example, specifically, a few of them that I would like to mention. One relates to women, the right of women in the context of COVID. On this, the special rapporteur, building on the general guideline of the Commission, specifically outlined a statement. We have also seen a statement by the Working Group on Indigenous Populations and Communities, specifically focusing on the protection needs of these minority groups and what states can do in that respect. We have seen, for example, in terms of country-specific responses, the statement issued on Burundi, for example, in the context not only of the right to health and issues relating to WHO, but also as far as the convening of elections is concerned. So these are the various, actually really a very thorough way of responding, drawing also the attention of the African Union heads of state and government, which have become the focal point in terms of mobilizing continental response. So we have provided input to that process as well, which is critical guiding member states.
Thank you, Solomon. Thank you so much. I think that's very insightful. What I think we get, among others, also is that civil society has taken up these statements, and the institutions of the African Union and the Commission's institutions. But one of the questions here is that, is there ever any evidence of the states actually, taking this up? Have you had some, kind of indication that, the message as far as states are concerned doesn't fall on deaf ears?
That is a very important question, Frans. As far as, in terms of how states made use of the statement, we haven't as yet, tracked, the specific ways by which states have made use of the Commission statement. It's only, you may find that only in respect to national human rights institutions, and to the extent that national human rights institutions, have made use of our statement, then that is the only evidence at this point in time that we have. In other instances, it's in engagements with national court systems when civil society organizations or others challenge certain activities of states in relation to their COVID-19 response measures and responses. But that is a very important, extremely useful question. Thank you for that.
Thank you. Thank you very much. Shall we go to Benyam for the Committee of Experts on the Rights of the Child? I think, Benyam, similarly, the issue of elevated, exacerbated vulnerability came in the questions. I think two groups that were particularly mentioned were the girls and their risk to increased gender-based violence, and then also children with disabilities, particularly visual and hearing impairments, in terms of being communicated the message around COVID-19. So I think the question is similarly then to you for the committee. In your guidance, how did you frame this as guidance to states to look at these kinds of particular vulnerabilities? And if I may add a second question, just to get it out there, another issue that was raised, perhaps it's more about school children being perhaps a vulnerable group. The question is whether we are not moving across the continent too fast to open up schools. How do we balance that? So the question, I suppose, to you as a committee member would be, has the committee had thought through any response in terms of balancing, the interest that would impact on a decision to open up schools in our various countries? Thank you, Benyam.
Very much, Frans. Thank you for those very interesting questions. I want to start with the first one, where, you framed it in a way where you asked Commissioner Solomon, how have states responded to it in terms of the statement that we issued? We will have to track and find out what the response has been. There are different ways of trying to assess that, but I can give you anecdotal evidence. For instance, a couple of weeks back when we were addressing the Peace and Security Council, ultimately the communique actually was endorsed by endorsed by the Peace and Security Council, and in the communique you can explicitly see wording that supports the content of the communique. One of the interesting things that also happened, I'm not going to name which country, but one of the interesting things that happened during that conversation with the members of the Peace and Security Council was also that there was, for instance, one country that had actually identified a specific aspect in that communique, which was making reference to sexual and reproductive health rights. There was a conversation saying, look, we're happy for you to actually keep the wording on reproductive rights, but we don't want you to keep the wording on sexual. So, during that conversation, we of course tried to clarify, but we also felt that there was an indication in terms of that, even though it's a negative, it might be seen as a negative response, there is attention that is actually being provided to the guidance note. Ultimately, I was not part of the discussion. It happened in a closed session, but we were very pleased that the Peace and Security Council actually endorsed the communique that the guidance that has been issued by the African Committee of Experts on the Rights and Welfare of the Child. Now, in terms of girls and children with disabilities and so forth, one-size-fits-all approach is not going to definitely help us. Yes, there are those usual, unfortunately usual group of children that are often finding themselves in the margins of society. I've already mentioned children in situations that are significantly affected by this. I can also mention about children that are deprived of their family environment. As a result of the dazes and separations and so forth that is taking place now, there will even be more and more children that will be deprived of their family environments. And states will have to assess, depending on the attendance circumstance that they have, which group of children actually are significantly affected and which ones need immediate attention. One of the general guidance that we're actually trying to provide, I mean, we talked about the Sustainable Development Goals. There is the notion that says leaving no child behind. Leaving no child behind should also, at the heart of it, needs to have reaching the furthest behind first. But as things stand now, if you're talking about girls, and I've already mentioned about some of the experience from the Ebola crisis, there is an increase on child pregnancy. There is an increase on violence against children. There is an increase on child marriage as people are unemployed, their economic background is debilitated and so forth. It actually cascades itself to the circumstance that children find themselves in. Now, generally, the violence against children issue is also being exacerbated by the fact that children are not in school, and I'll explain. For instance, in a number of instances, schools and particularly teachers are the frontline workers who actually identify violence against children in the home setting. And that's the main reason why in a number of African countries and elsewhere as well, teachers actually have the duty to report. But currently, because children are actually not in school, the possibility to actually report on some of those violations that are taking place in the home setting is falling between the cracks. Now, let me come to the education point that you have flagged. It's an issue that has received a lot of attention from the international community as well. You can look at the number of publications from UNICEF, UNESCO, and so forth. 1.5 billion children that are out of school. They're not getting the necessary attention that they deserve and so forth. I'm just going to move in on 2 or 3 issues here, particularly for the African continent. As I've already said earlier, it's absolutely critical that our interventions are informed by the data. And I'm just going to throw a data here. In Sub-Saharan Africa, 89% of learners do not have access to household computers. 89, that's a staggering number. 82% lack internet access, and around 28 million learners live in locations not served by mobile networks. So if we're really genuinely concerned about the education and the learning crisis that will be created as a result of the COVID pandemic, we shouldn't just only be talking about internet access and so forth. We should also be talking about what should be the role of radio programs, which are low cost and easy for children to access without the internet. Provide books and printed materials delivered to families or available from community hubs. We need to be able to have a conversation that we know for a fact that language plays a very important role. We know more than 58% of websites all over the world are in English. So if we're talking about children having education while in lockdown, we need to also be able to address what is the extent to which children from minority languages in the majority of African countries, that is the case, whether or not they're having the necessary access for education as a result of the pandemic that they are facing. Let me throw 1 or 2 points. You mentioned, I mean, the debate here in South Africa is alive and kicking. What should be the situation about school openings and so forth? Again, one size doesn't fit all. We need to keep one thing in mind though. There are a lot of children on the African continent that benefit from a school feeding scheme, either 2 meals or 1 meal a day. When schools actually get locked down, we've seen it here in South Africa, not in the COVID situation only, but even when there are labor protests, when they get locked down because of labor protests, a lot of children actually miss out from those school feeding schemes. So the consideration should not just only be about whether schools are actually going to open so that parents can have a bit of free time on their hands, whether the children can actually be educated. It should also be about the protection issues that needs to be addressed. It should also be about the school feeding mechanisms that the children can benefit from. And it should also be about the negative effect that extended lockdown is going to contribute to the learning crisis that we're facing on the African continent. Maybe one final point, and I leave it at that for now. France, quite a lot of the lessons that we learned from the Ebola crisis should be able to help us to understand the situation of COVID and children's rights. And we shouldn't abandon. I come back to the Ebola crisis because there were a lot of lessons. One of the lessons was that engaging with community leaders is an absolutely critical element in this whole process. If we are bringing community leaders when we face a crisis and we take them out of the table and out of the equation when a crisis actually goes away, we will lose on education, we will lose on the registration, the birth registration drives that we want to do, we will lose on the measles vaccinations and the routine vaccinations that we actually want to provide to children. And secondly, and this will be my last point, child participation. There was a lot of conversation about political participation and so forth. Child participation is often missing in this link. I mean, quite a lot of you might have seen the debate in Madagascar about that drink. Some of the information actually says children are being forced to actually drink those things. What should be the role of the voice of the child in all the responses that we're actually trying to provide to address the COVID pandemic should be central to the response that we are crafting.
Thank you, Benyam, for those very interesting and insightful responses. I think you mentioned the issue of participation. One of the questions, I think Ms. Izobo interrogated the way in which the APRM reviews will be proceeding, given that there is an expectation of a participatory and inclusive method being used in the national reviews and the whole process. So could you perhaps just give some reflections on how that, in your view, would proceed?
I mean, for now, almost every state is on lockdown or they are partially locked down. And so what the APRM has decided is to continue with the peer review process. But the first thing first, before a country is being peer reviewed, the participating country will need to carry out a country self-assessment review. And this is done internally in the country. That can actually go on with or without the COVID-19 pandemic. And after that, the APRM then does its own research through background papers that are now sent on the 4 thematic areas that I also mentioned earlier. And those background papers are then sent to the country, where a team is then sent to the APRM participating country to carry out the review process. But currently, with the COVID-19 pandemic, this is almost impossible to happen. And so what the APRM has decided is that these countries can actually go ahead and carry out the country review process, which would then be sent. So virtually, they would need to do this virtually, which again, these mechanisms are not fully in place to carry this out. And this is the whole point of where APRM is now trying to work on its methodologies and its tools to include where peer reviews can actually go on virtually. So this is the point where the APRM is right now.
Okay, and the question will be, to what extent can that at the national level integrate the participatory approach that is desired? But thank you for your response. That clarifies the issue. I think clarity was required, Commissioner Dersso. You mentioned the session that's coming up. So the question that seems to come up is whether this is now an actual ordinary session that you are talking about that will take place virtually in the nearish future, or is this like just an ad hoc special meeting of the Commission on COVID-19? If you could just clarify that for us, and sorry for the vehicle going here.
Okay, thank you, Frans. So, I mean, in the context of, in the context of, you know, the changes that are happening. So for us, really, we have, so for example, in terms of the ordinalization, it would require us the participation of all those stakeholders that I made reference to earlier on. Some of the activities, like for example, state report review processes, whether we have the logistics, you know, the technological capabilities to allow a very participatory, inclusive, and also secure system is yet to be worked out. So it's really difficult at this point in time for me to tell you, you know, with certainty how this arrangement is going to be like. taking the form in particular of an ordinary session. I think for us, the most immediate concern really is there are a lot of very pressing human rights issues arising from the COVID-19 response measures and from COVID-19 itself. And these human rights issues require engagement and a very robust and sustained engagement. And one of the ways that the Commission can do that is if it convenes, a conversation virtually with its various stakeholders. That is really the main interest and area of focus. How and when exactly is something that we will announce as per usual.
Thank you. Thank you. I noticed that the time, unfortunately, is running out. We don't want to really overstay our invitation. So let me ask the four panelists to briefly, in conclusion, respond to this question. The question, often it is raised, yes, it's a calamity, but the calamity provides opportunity. So aren't there opportunities in the way in which we have to adjust now? Wouldn't we perhaps post-COVID find that we now can do things differently, more virtually? For example, take the example of state reporting. If one does virtual state reporting, perhaps you can ensure the high level of state representation and engagement because no one is required to come to Banjul or to others or wherever the case may be. It could involve more civil society organizations if they don't have to pay and transport themselves. And in the Pan-African Parliament, clearly, we can work and save much and be more effective and efficient. So do you see, after the dust has settled, that actually the working methods could be fundamentally changed to be more inclusive, perhaps more effective because of a move towards virtual worlds? I ask perhaps in the inverse order, perhaps I ask Clement to first just briefly give your views. Do you think that this could fundamentally change the way that the Pan-African Parliament would operate into the future? Clement.
Yes, indeed. We are already seeing it. I will just first take one example. On the Africa Day, for the first time, the Pan-African Parliament was able to engage with the public virtually. And the level of engagement was a good lesson and a good test for the institution, because up to some point, we have been having internal meetings virtually, working well as a secretariat, working well with the Bureau, but we had not yet had an experience to engage with the public, to engage with the members of Parliament from different African countries. And it was an opportunity for us to ascertain, on the one hand, that the institution has the technical capabilities to be able to work virtually, and to assess the readiness of the members of Parliament to be able to also participate virtually. And we believe that virtual meetings will increase the level of attendance of the members of Parliament, will make the participation of civil society more meaningful, will also enable us to use our resources very efficiently, particularly where physical meetings are not necessary. So I would agree that virtual meetings would be a way to go, and PAP is looking to that direction. And yeah, so COVID-19 is, I mean, there are opportunities that come with
Exactly.
COVID-19 itself. Thank you.
Thank you so much, Clement, for that view. Ms. Izobo, how do you feel about APRM also using this as an opportunity to perhaps fundamentally review its ways of operation and become perhaps more effective and participatory?
The APRM already started the whole virtual meetings and the reporting that they have been doing virtually. And this is very important because, I mean, I don't think the COVID-19 would, it has changed the way the institutions work completely. Like the APRM forum meetings usually doesn't have such high attendance. And I believe that right now with the inclusion of virtual meetings, with the inclusion of things now done online, it would also increase participation to all of these meetings. Even currently, they already are communicating virtually through to the RECs, the regional economic communities, and also the APRM member states, who have also been very responsive to this. But most importantly, I believe that this has also opened a doorway and an avenue for the APRM to be able to revise its tools and methodologies, and also to work with other institutions. Let's take the African Risk Capacity, for example. This is a specialized agency of the African Union that actually help African governments to improve their capacities to better plan, prepare, and respond to extreme weather events and natural disasters. And I think this is an opportunity for the APRM to actually serve as an early warning tool where they can actually work with the ARC for the prevention of health crises and disaster, such as the COVID-19 pandemic, not just for now, but for any other disaster that might actually happen in future. And then as a woman, I am speaking that APRM can also use, they have the targeted reviews that they usually conduct. They can actually use this to engage the civil societies where they do not have to go there physically, but to engage, to have a far more reaching spread to civil societies, to community-based organizations that can actually speak specifically to gender-specific governance responses to the COVID-19, where it is clear that women do need specific gender responses by states. In the cases of the Zika virus, the Ebola, and the recurring effects of HIV on women. And so it is very necessary that the reporting that they put out there would enhance and also engage the civil societies at all levels, at all areas where they do not have to physically participate, to come together under the APRM umbrella virtually to address all of these issues.
Thank you so much. Benyam, in terms of the committee's view in your perspective.
Thank you very much, Frans. Yes, it inevitably changed quite a number of working methods, but not just only, I want to reflect on this point, not just only based on my experience within the African Committee, but also within my experience within the UN Committee, because within the UN Committee, we've actually been doing quite a lot of online work. So from a working methods point of view, it helps in terms of having a high-level delegation as well. In a number of instances, the minister might not be able to travel 6-7 hours to come for a session, but if it's an online one, you might actually have a head of delegation that is as close to decision-making as possible. So it has helped based on that experience. It has also helped to facilitate participation by children with disabilities, children from marginalized communities, and so forth. I mean, how many of our children on the continent actually have passports? I'm not even going to talk about some of the challenges that we have when we want to have children come to Geneva for the session because of visa and so forth related issues. So it definitely addresses quite a number of working methods issues for the positive. But I just want to throw a 1% negative that I have also experienced. When a state party review process is open to the whole world, so whoever has access to the internet will be able to see it, 1% shortcoming that I have seen is that there are a number of few occasions that I've witnessed where a head of a delegation wants to say something to commit his or her government, or a member of the bureaucrats that is part of the delegation wants to say something, but it's actually being webcasted all over the world and you're not sure who's watching. So it might also affect a bit of your freedom of expression and the level of commitment that you can actually bring to the table. So that's one downside that I've experienced based on my experience within the UN. Now, Frans, if you give me 30 seconds, I want to say it's not just only in terms of working methods that this is actually shaping it. For me, as a member of the African Committee, it is also shaping our work significantly substantively, as I've said in the past. And I just want to single out 2 or 3 points here. One is, substantively, it is merging significantly the civil and political rights conversation and the economic, social, and cultural rights conversation that we often have in the context of children's rights. I'll just give you a simple example. In many instances, even in civil society organizations, the people who actually do the alternative report are usually the child protection officers or the lawyers and so forth. Usually the issue about water, sanitation, and so forth doesn't get the necessary attention in the treaty body process. So this pandemic will inevitably push us in that direction where those issues, WASH issues, also get the similar attention. And secondly, it is also shedding light on the importance of social grants. The African continent, more than 60 or 70% of the people are actually in the informal economy. So if you're actually talking about tax breaks and here and there and so forth, that's not going to help those in the informal economy. So the importance of introducing social grants, my own government in Ethiopia has done it. Quite a number of Southern African has done it. A number of countries in West Africa, but Central Africa, it is in early stages. Malawi is a good example. Last month, they introduced a $40 support. It goes a very long way in addressing some of the challenges that children face, including child marriage. I mean, with the current situation that we're facing globally, we're looking at an additional 4 to 5 million new children that are at a risk of child marriage. And those child support grants, those social protection measures go a long way in protecting children, not just only in the time of crisis, but also in the time of peace.
Thank you very much, Benyam, for distinguishing also between the kind of working methods and the substantive impact or opportunity that is presented. And then to conclude, we go back to Solomon, the chairperson of the African Commission on Human People's Rights. Solomon.
Thank you, Frans. I think in terms of working methods, I think the opportunity that we have is basically it would accelerate, for example, some of the initiatives at the level of the African Commission, such as the streamlining of the proceedings of the Commission. So that is one thing. And the other is obviously, I think it would potentially help the members of the Commission, but also stakeholders to embrace the possibility of engaging in the work of the Commission through this virtual mechanism and process. And as rightly pointed out, there are a quite large number of the public who would have interest in engaging and participating in the proceedings and work of the Commission, but couldn't do so for a number of reasons, including those that I've mentioned already. So in terms of expanding the diversity of stakeholders who would be able to participate, certainly I think it would have that effect. I think it's, however, extremely important that there is a clear analysis of what the added value of going virtual is and what the disadvantage of going virtual would be. I think that's extremely important. I don't think that we can make a conclusive statement that this would be totally beneficial in terms of the working methods and arrangements of the Commission. I think one of the things from, for example, studies on what we call norm diffusion, on diffusion of norms. Socialization is extremely critical. I'm not really sure how virtual engagements would facilitate socialization. And with the socialization, of course, the inclination of people to accept and also to trust processes and systems and so on and so forth. And from that perspective, I don't think that we would, be in a situation where we would end up in a virtual process altogether. I think there is a huge value from physical meetings that we shouldn't abandon altogether. So we shouldn't have a situation whereby we basically throw the baby with the bathwater, so to speak. I think there is a balance that we need to make. I think from a human rights perspective as well, there is an issue that we need to also reflect on in terms of participation. Again, that depends on points that have been made in terms of access. But from a substantive point perspective, this is something that the Commission has been consistently speaking about. COVID-19 has highlighted that the state of human rights in Africa, particularly socioeconomic rights, is extremely terrible, that the continuation with this would actually leave everybody vulnerable. So there is actually a case that needs to be made in terms of how do we, as we respond to COVID-19, but also moving forward, what do socioeconomic rights mean for social policy, for economic policy, and what kind of, obviously the question of responsibilities and roles do states bear in terms of those social and economic policies. And the final point that I would like to make is, from all the conversations that we have been having, one thing that has become clear is whether in respect to vulnerable groups or in respect to children, I think the broader human rights context in which issues affecting vulnerable groups as well as children matters a great deal. And what that says is basically we need to have a much more synced, a much more interdependent and coordinated engagement. If we create, a broader human rights compliance space, then that can also facilitate in terms of addressing the specific needs and concerns of various sections of society as well. I think this interdependence issue needs to be seriously taken into account.
Thank you. Thank you so much for those insights and also your balanced view about the advantages, but also the disadvantages of virtual replacement, if you like, of the in-person sessions that we always had known. I think at the center, we just presented our first short course. We have these short courses on human rights aspects. The first virtual course, I see some of the participants are also attending today. And we were really impressed by how much one can actually get done, how well a course works, but at the same time, what one sacrifices, your reference to socialization as an important and integral means of training, teaching, and also getting people committed to a course. So thank you for that. And that's also a positive note to end this conversation. Let me conclude by just thanking everyone. I thank, first of all, you, the members of the audience, participating in this discussion forum. We really appreciate that. Your comments, your questions, I think were very, very rich. I suggest in the last few minutes, if you still have time, look at that. We have some suggestions, Benyam, for example, for a continental study on COVID-19 as it impacts on children that had been raised. We have suggestions also really for everyone to look into the right to internet access. Maybe that is the new frontier for human rights thinking. But once again, for your time, for your active participation, the audience, the members who participated here, we thank you really very much. I remind you that this is a weekly event. Thursday next week, starting at 11 same time, we'll have another of these discussion forums where alumni of the center's academic programs will present. And next week, in fact, we will look at socioeconomic rights. So the impact of COVID-19 in the context of Africa on various aspects of socioeconomic rights will be our topic next week. Let me also thank very much our presenters. We were really privileged. I think many comments in the chat box also indicated appreciation for your insight and your contributions, your reflections. So thank you so much. We know that the demands are surprisingly many, even if one lives in the virtual world. We appreciate your time, Solomon, Benyam, Clement, and Mary, we really do. And then also to our technical team, everyone involved, Tomiwa, who is the alumni coordinator, Yolanda, the web person and communications manager, and also Taruna, who assists with these talks and these discussion fora. So thanks to everyone. And also be reminded that these proceedings have been recorded. We will send a link to you so that you can further share or reflect on those. So once again, many thanks. We hope to see you back here. And we wish you, and I wish you, certainly prosperous safe and sane day and further lockdown period, wherever you are, whatever it means to you. We wish that you'll be taken care and that you'll be, the best person you can be within these circumstances. Thank you and goodbye.
Thank you very much, Frans. Thank you to all those who participated in this, following us. Thank you.
Thank you very much from my side as well. And for those that are interested in continuing the conversation for some of the questions, I've put my email address in the chat. Thank you very much.
Thank you. Thank you, Claire.
Thank you. Thank you very much.
Thank you so much, everybody. I'll also put my email address below.
Thanks.